name is Michael Burns, head men's basketball coach at Rhode Island College, going on my fourth season.
My name is Justin Shovall. I am an athletic trainer here at Rhode Island College. My position is an assistant athletic director for athletic medicine and club sports. I do work with people, probably that's 3/4 of my day. My first part of my day is more administrative, but the second part is working hands-on with student athletes. It's a mix, some prevention, some treating current things, and then also providing on-site coverage at our practices on the court, on the field, for anything that could potentially happen, so that you're there in the case of an emergency.
The most difficult one, I would say, is concussions. Obviously, it's new. When I played, I can remember being hit in the head and so-called seeing stars, and it was just you rang your bell and you went off to the side and rubbed some dirt on it and felt better and went back out there again. Due to the CTE and all the studying that has gone on since that time, there are more and more issues that are coming around of the concussion protocol. So I'd probably say concussion just because it's so difficult to detect.
It doesn't happen too often, but occasionally somebody may dislocate a joint, or ankle dislocation, or shoulder dislocation, which is more significant, that requires more of an emergency situation. The ones that always make me most nervous is somebody that might lose consciousness for a brief period. With head injuries, there's a very wide range of them, and approaching somebody that's unconscious is always, that can be a scary thing. But we have the training to be able to know when it becomes an emergency or how to handle those situations. The concussions are really difficult. There's so much information out there, but yet there's still a lot of unknown. And part of the difficulty is, when you see an ankle injury or when you're working with them to get it better, there's a lot more objective things there that you can look at and assess and monitor the progression. And a brain injury is different. There's a lot of conversation that can be had, but a lot of it's very subjective. There are some testing, but nothing's perfect, and it's a lot more complex to deal with. Prevention, trying to take care of their bodies. In general, trying to deal with inflammation conditions, like everybody gets certain body parts overused, so icing afterwards. Sometimes they can benefit from some heating before to help transition into exercise. Teaching people stretching regimens, how to be able to stretch certain body parts.
We have a phenomenal athletic staff here. We have 3 people that work in our athletic office, the training office. They do a great job working with our athletes and our trainers for whatever sport or whatever team's about ready to practice. They're in there an hour before. So if guys want to go in there and take an ice bath, if they want to get in there and get some heat, get some stem, all that stuff is in place here at Rhode Island College.
You can't plan what's going to happen, and no amount of prevention is going to maybe prevent every single thing. So I think some injuries are preventable, like overuse injuries. Maybe you could be wiser about how you're taking care of your body, types of rest, or active versus passive, your strength training program. There's a lot more levels that can maybe modify or prevent you from getting an overuse injury. But as far as if someone is going to get a cut or a laceration or an elbow to the eye that causes it to split open, or steps on someone's foot and sprains an ankle, that's just going to happen.